Vitamin B6 deficiency is a silent actor in modern mental health, often misinterpreted or overlooked entirely. The symptoms it produces, depression, anxiety, irritability, brain fog, confusion, even hallucinations in severe cases, are strikingly similar to those seen in common psychiatric conditions. Yet B6 is rarely tested, rarely discussed, and almost never prioritized in clinical practice. This is not a minor oversight. It's a systemic blind spot in the way we diagnose and treat mood and cognitive disorders. The consequences are profound. Many people are being medicated for conditions that may, at their core, be the biochemical echoes of a simple nutrient deficiency. The overlap between B6 deficiency and psychiatric symptoms is not anecdotal. It's well documented in clinical literature. In fact, the early signs of B6 depletion are almost entirely neurological and psychological in nature. People may present with low mood, excessive worry, irritability, sleep disturbances, and difficulty concentrating. These symptoms closely mimic depression, generalized anxiety disorder, and even elements of ADHD. In more advanced cases, B6 deficiency can cause neuropathy, paranoia, or seizures, symptoms that could easily be misread as schizophrenia or a neurodegenerative disorder. But the key difference is that in B6 deficiency, these symptoms may be reversible. With adequate intake and proper absorption, the brain's chemistry can often recalibrate. Unfortunately, this possibility is rarely considered. The misdiagnosis risk is compounded by the fact that B6 is rarely included in routine blood panels. Even when it is tested, the results can be misleading. Serum B6 levels don't always reflect functional status, especially if the body's demand is elevated due to chronic stress, inflammation, medication use, or alcohol consumption. A person may have enough B6 circulating in the blood, but if it's not in its active PLP form, or if cellular absorption is impaired, deficiency symptoms can still arise. This leads to a dangerous gray zone. The labs may look normal, but the brain is still starving for coenzymes. This disconnect has created a situation where people are routinely prescribed SSRIs, benzodiazepines, stimulants, or antipsychotics, often for years, without anyone ever asking whether their neurotransmitter pathways have the raw materials they need. Vitamin B6 is absolutely essential for the synthesis of serotonin, dopamine, GABA, and melatonin. Without it, the brain cannot properly regulate mood, stress, motivation, or sleep. If those pathways break down, symptoms emerge. But the root cause isn't necessarily psychological trauma or chemical imbalance. It might be biochemical insufficiency. To be clear, this doesn't mean that all psychiatric conditions are caused by nutrient deficiencies, or that vitamins can replace thoughtful mental health care. But it does mean that in many cases, we're skipping the most basic question: does this person have the nutritional foundation necessary for a stable mind? When B6 is missing, neurotransmitter production stalls, stress response becomes erratic, and mood regulation becomes increasingly fragile. And when these symptoms are treated as psychiatric in origin without exploring metabolic causes, we risk turning a treatable deficiency into a lifelong diagnosis. The issue is further obscured by the nature of B6 depletion. It develops gradually, often invisibly. People don't suddenly collapse from B6 deficiency. They slowly become more irritable, more tired, more anxious. They struggle to sleep. They lose their emotional resilience. These are not dramatic symptoms, but they are deeply disruptive, and they are easy to misattribute to the stresses of life, hormonal shifts, or purely psychological factors. In this way, B6 deficiency often hides in plain sight, its effects attributed to everything but the actual cause. Medications can also exacerbate this cycle. Birth control pills, antihypertensives, isoniazid, hydralazine, and some antibiotics interfere with B6 metabolism. Ironically, even antidepressants and antipsychotics can further deplete B6 by increasing metabolic demand or impairing absorption. So, the very drugs prescribed to manage symptoms may deepen the deficiency that caused them in the first place, trapping patients in a feedback loop of worsening symptoms and escalating interventions. Even diet cannot always correct this, particularly in modern food environments. While B6 is present in many foods, chicken, fish, potatoes, bananas, fortified cereals, processing, cooking, and storage destroy much of its content. And if gut health is compromised, as it often is in people with chronic stress or medication use, absorption can be significantly reduced. This makes it entirely possible for someone to eat, well, on paper, yet still suffer from functional B6 insufficiency. The most troubling part is how easily correctable this can be. Low-dose supplementation, particularly with the active form, P5P, can rapidly restore neurotransmitter synthesis in many cases. It's safe, inexpensive, and well-tolerated. Yet, because of the entrenched separation between psychiatry and nutritional biochemistry, this approach remains largely marginalized. Patients suffer. Symptoms persist. Medications pile up. And all the while, a simple coenzyme deficiency continues unrecognized. Ultimately, the failure to consider B6 status in mental health is not just a clinical oversight, it's a reflection of a deeper problem: our collective underestimation of nutrition in brain function. We've been conditioned to view mood and cognition as abstract phenomena, disconnected from the physical substrate of the brain. But the truth is far simpler and far more empowering. Brain chemistry depends on nutrient chemistry. And in that equation, B6 is not optional. It's fundamental. Until the medical community fully integrates this knowledge into diagnosis and treatment protocols, many will continue to suffer needlessly. The hidden truth is that not all mental illness is mental in origin. Sometimes it's chemical, and sometimes that chemistry begins with something as small and as vital as vitamin B6.